Hi, my name's Steve Corey, and I want to talk to you about just a couple things today. Number one, I want to talk to you about the Makoplasty knee surgery that I had about 6.5 months ago. And secondly, I just want to briefly introduce you to a product that I used before my Makoplasty surgery that really helped me out with my joint pain, and just share that with you, and maybe it'll help you or something. So anyway, like I said, I'm Steve Corey. I live here in Ogden, Utah, right at the foot of the Rocky Mountains, and I'm 54 years old, and I'm a real outdoors person. I just love to do things. I like to ski, I like to golf, I like to hike, I like to mountain bike, and I just like to do a lot of active things. And what happened to me, just to tell you a little bit about my background, is when I was a young guy, about 19 years old, I used to race motocross, and ended up having a bad crash and just blew my right knee out pretty bad. And tore my ACL and just ripped some cartilage out of the inside of my knee. And back in those days, the doctors, when I went in for surgery, they just took the whole cartilage out. You know, they didn't just snip it out like they do now. I think they took the whole side out. So anyway, and then they elected not to replace my ACL back then. Technology just wasn't as good as it is now, and wasn't as easy as surgery. So I went without an ACL in my knee until 1997, which was about 17, 18 years without an ACL. And what that did was cause my knee to be unstable, and it just rubbed back and forth and just ground my bones flat on the inside of my knee. So I limped for years. I've limped around everywhere, you know, and it's kind of embarrassing, but what do, you know? So just last summer, I stumbled onto something on the internet, or there was a radio ad or something on this Makoplasty knee surgery that was a partial knee replacement and not a full knee replacement. And I started doing my research and was very impressed with what I found. What I liked about it was I wouldn't have to have a total knee replacement and remove all that good bone and stuff from the outside of my right knee, when really the only problem part was on the inside of my knee. And also, if you have a total knee replacement, they take your ACL out. You no longer have an ACL ligament. And I didn't like that at all, especially, you know, for skiing and stuff like that. So I went in and just had a consultation. I went to the Hoffman Arthritis Institute in Salt Lake City, Utah, and my doctor was Jeremy McCandless. And so we found out that I was a good candidate for the Makoplasty. So I went in on September 24th, 2012, and I had the surgery at the Salt Lake Regional Medical Center. And I have to tell you, just to give them a review, I had received excellent care from the Hoffman Arthritis Institute, and I had to stay for 3 days at the Salt Lake Regional Hospital, and it was just incredibly good care, good service, totally recommend it. Very happy with it. But just to tell you a little bit about my recovery process, the first couple weeks were pretty rough. You know, I was in a lot of pain. And that's when I was taking the heavy painkillers for about the first 12, 13 days, something like that. And then I ran out, and I chose not to refill my prescription because I got sick of taking those things. And I just went to taking ibuprofen and stuff like that for a while. So, you know, I had home care come in and did some physical therapy on me. And the guy showed me exercises to do, and we just worked on getting my range of motion back. And they only came for about, I think, 3 weeks or something, maybe a month, I can't remember. But it wasn't all that long, but I really worked hard at the rehab and the exercises they showed me to do, and that's very important. The most important part, because you want to get your range of motion back in your knee. In fact, right now, it's better than it was before. I don't know if I mentioned it, but I did go in 1997, and I had my ACL reconstructed. So I got an ACL put in, and that really helped me out. I went back to work after about 5 weeks or so and just gradually got back into it because my job's really physical, so I had to do it slowly. And then my first golfing, I went golfing at 9 weeks after surgery, and I played 18 holes of golf. I took a cart this time. I usually walk, but took a cart, and I literally had no pain when I swung. I mean, I was expecting maybe to feel some pain when I hit the ball and stuff. No pain whatsoever. It worked out great. I couldn't even believe it. I went skiing. 3 to 4 months into it, I went downhill skiing, and I actually went several times through this winter. And let me tell you, that's one reason I had the surgery done, was because I probably could have went a year, 2, 3 more years without it. I still would have been in pain, but I wasn't excruciating pain. But skiing became really painful, and I was at the end of my skiing career if I didn't have something done with my knee. That's the main reason I decided to go with it at my age of 54, was because I want to ski, man. So I went in and had it done, and I went skiing. And I got to tell you, I literally found myself laughing as I was going down the slopes a little bit. I was laughing to myself because when I turn really hard, and normally it would really hurt, oh my gosh, I couldn't even feel it. My knee just felt great. And now I'll catch myself walking into like a grocery store or just anywhere, and all of a sudden it'll just hit me. My knee feels so good. It feels like the knee that I was born with. I mean, it's just awesome. So I couldn't be happier with the Hoffman Arthritis Institute and the service I got there. And just how my knee feels now, not even 7 months into it. It feels so good. I can't even believe it. I am so happy with it. And I feel so lucky that I ran into the Makoplasty procedure, because I think it's awesome. It's a great thing. But I just want to show you a couple pictures of my knee. This is what you're going to have in your knee if you get it. There's a picture of one of my x-rays that I had at the hospital. And if you'll see this screw over here, that's not part of the Makoplasty. That's what's holding my ACL in my knee. Okay, and I'll show you this other view. This is a front view of my knee. Again, you can see the screw over here, but that just shows you kind of the hardware you're going to have in your knee and how it's just a partial knee replacement. And I'm telling you, I'm so happy with it. I can't describe it. Just very pleased. But told you I was going to talk about one other thing. And before I had my surgery, my wife actually introduced me to a product that you can't find in any stores anywhere, and it's called Precosa. It's made by USANA Health Sciences in Salt Lake City, Utah, as their world headquarters. And this is an incredible product that literally, my pain level when I went in to get my surgery, they ask you what your pain level and stuff is, and I'm like, maybe a 2 or a 3. That's because I was taking the Precosa for months beforehand. And just to give you a little background about why this is such a high quality product, and it's such a scientifically thought out product, you won't find anything like this in any stores. USANA Health Sciences is an FDA facility. They make nutritional supplements that are pharmaceutical quality. These are extremely potent and pure, and you can totally trust them. So you can do your research on that if you want. But just a little story. After playing 18 holes of golf before I had my knee done last year in the summer, and I'd been taking this product for about 2.5 months, close to 3 months, and my friend and I were having a beverage in the clubhouse afterwards, and we were just talking about it, and I told him I'd been taking this for a while, and it was making my knee feel better. And he says, you know what, I noticed you weren't limping in the last 3 or 4 holes lately. And it caused me to pause and think, you're right. I haven't been limping down the stretch out golfing. And that's when I realized, that it was really helping. And as time went on, then I just noticed that, I still had joint pain when I did things, but, nothing like it was before. So it did give me some relief. But if you're interested in learning about that, you can go and check it out at my website, stevecorey.usana.com. That's Steve Corey, C-O-R-E-Y, at usana.com. Go on there, click on the nutritionals link, and go find the Precosa. That's the name of the product, Precosa. Check on that, and you can click on it and get a ton of information on it. Now, if the prices, if you decide to shop on that site, the prices are retail prices. You can get this at wholesale or even 10% below wholesale if you're interested, so you don't have to pay retail. But I'm not really, telling you this just to sell a bunch of the product. I just want to help people like I was helped before. And that's the main thing, is these products work, they help people. And if it helps you, because I know you have knee pain, if you're probably watching this video, you've got some knee pain going or joint pain. But anyway, do your research, and you can shoot me an email on that website, and I can contact you and we can talk about it or whatever. So anyway, but I just want to tell you how happy I am with my Makoplasty surgery, and I would highly recommend it. Go out, get it done, and I wish you the best of luck. Thank you.